My name is Justin Cromlow, and I'm the CEO and founder of OPOS. And we're here speaking with one of our customers, Dr. Neil Soni. Dr. Soni, could you introduce yourself and tell us a little bit about your practice?
Hi, my name is Dr. Neil Soni. I am a board-certified PM&R and pain management provider in a multi-specialty group practice, but I'm the only pain provider in the practice. I do inpatient and outpatient pain management, medication management, and procedures.
Initially, what challenges led you to seek out OPOS? What were you looking for in a solution?
Well, I was looking to find ways to protect myself, lower my risks for investigations, medical board investigations. I was just trying to figure out a way to make sure that my documentation was more robust so that anybody looking at my charts would think that I am meeting all of the requirements regarding the pain medications. So it was mostly just how do I reduce my risks so that I can continue to practice medicine and pain management in this highly litigious world of pain management.
And Dr. Soni, as you think about when you were looking at OPOS and you selected OPOS, what other options were you looking at, and how did OPOS compare to those other options?
The options were me trying to figure out everything on my own and looking for individual solutions versus OPOS sort of spoon-feeding me all of the information that I needed. They provided a one-stop shop with everything that I was looking for in trying to protect myself.
And when you think about when you started with OPOS, can you tell us a little bit about your experience?
I convinced my team saying that we are going to do this, we have to do this, it will protect us and allow us to go forward as well as make us a little bit extra income. The staff got on board, and once the staff was on board, it was easier to get the patients on board.
Can you talk for a few minutes about your perspective within the practice of you and your staff of the implementation and how OPOS supported you through that and how you managed that change internally?
OPOS worked closely with my office manager on billing questions, how to go about billing the visits and scheduling, and then how to sort of coordinate the education notes into our EMR. So I do remember having a specific liaison in the OPOS family there to work with my office manager, and they would be sending emails. I would be involved in it as well. There were a few bumps here and there. It all got ironed out, and whenever we had a question or an issue, we would just send the email out or a text message, and we would get a response pretty quickly within same day. The next day we would have a response as to how to fix or the answer to our question. The ones that first were very hesitant about doing the classes and the education classes, those patients have been coming saying, I love this topic of the class this month, and they're looking forward to the next class that they have to do. But that first initial few months of getting people to do the class was a lot of repetitive on my part, on my staff's part, saying that we have these new policies in place. If they're not followed, you would be non-compliant, and then put on the weekly visits, weekly trips to the pharmacy until they became compliant. And the ones that were really in need really wanted the help from us to do it in the right way, and that we're not just looking for medication refills easily.
What are the most meaningful results that you've seen, both within your practice as well as among your patients?
Well, doing the education classes and then doing the group visits, the group SMA visits for prescribing, it's allowed me to actually not have a nurse practitioner or a PA in my office where I'm seeing all of my office patients and doing all of the prescribing. So I know what's happening with all of my patients. It's allowed me to have more procedure time and have more time in the office for patients coming in saying, oh, I want a knee injection or whatever type of injection that they want done. I've got more time in the office for those types of visits.
And from your patient's perspective, have you seen any changes from them if you think about before the education and, in thinking about the education as well, something that you mentioned, the SMA, which for people who don't know, that's a shared medical appointment, that's a group visit. How has the participation in the group impacted your patients?
I believe my patients have enjoyed that part because they don't have to spend as much time coming into the office, the driving, finding parking, waiting in the office for me when I'm running late or anything like that. That time commitment for them for their monthly visit is now only 20 minutes online, not having to go anywhere, versus the potential for it to be an hour. A lot of my problematic high-risk patients either were self-discharged or we were able to wean down a lot of the narcotics as well. My total MME count has definitely reduced since doing this format, because one of the questions that we always ask every patient in the group visits is, are they ready to taper down? And I'm getting at least a couple of people every visit to say, yes, I'm ready to reduce my medications, or to have a conversation. So that has definitely been helpful. Patients have enjoyed talking with other patients, or I'll ask questions in the group if anybody has a comment or a question that would benefit the group about like side effects, and they're happy to interact on how they handle certain things and what has worked for them. And some patients enjoy that aspect. Other patients will say, oh, I just want to hear you and get out of here quick as possible so that I'm not wasting too much time. But that's a different different topic there. Yeah, they're more willing to have that conversation about reduction, switching over to like Suboxone, and also they are more willing to talk about procedures and therapy as well.
Every time you're going to write a prescription, you ask them if there's an adjustment that may need to be made, and because of their education, they actually are able to identify those opportunities.
Yes. Patients will come, they will say, in this last class we were talking about acupuncture. Can I have a referral for acupuncture? This was interesting about the pain medications affecting my sleep in this way. Maybe I need to work on that. Or I heard about narcotic rotation in the class. Can we talk about that? So they are definitely coming from the education classes asking more questions about, if I develop tolerance, would it be a good idea to do a break or something of that nature? So they are more willing to make changes, and rather than just same old, keep refilling the same medications over and over again.
I'm interested, as you kind of look at how OPOS has impacted your practice, your staff, your patients, what the most meaningful results are for you.
I believe the most meaningful result is that I feel safer prescribing the narcotics because I have done all of these things to mitigate the risk by having the education, having the foresight surveys and things like that. It allows me to feel a little bit safer in the ability to continue prescribing narcotics for people that truly do need the narcotics. As in the current situation or climate that we're in, there's a lot of stigma for the opioids, and they want us, it seems like they don't want anybody to prescribe any narcotics for any reason, but there are certain patients that still do need their narcotics to have quality of life, to function, to participate in society. And so I feel like this has given me that security in knowing that I am not putting myself at risk, not putting my patients at risk by continuing to treat the patients.
And correct me if I'm wrong, Dr. Soni, but before OPOS, when you or one of your APPs would come in for the day, you would basically see each patient not knowing what you were going to face when you walked into the room, but then knowing that you had other patients waiting, so you had to kind of get to the patient. So whether or not the patient needed more time, you were somewhat limited by the schedule of the day versus what you described now, which was that if a patient is low risk, you have a certain model, and as the risk level goes up, you escalate your contact time with them and the frequency of your visits with them to help address their issue. And so I think that's important. I just wanted to point that out if that wasn't clear to people, because I think what's very interesting in the conversation that we're having is that the things that we're talking about, you've been using for 3 years, so they're just more tools in your toolbox. And from my perspective, I think that this is a critical part of where the standard of care for opioid management needs to go. And a lot of these concepts are very straightforward to us because we've been using them. But I think to others who would be out there watching this, they're still in that model.
I've seen some patients that I didn't know were living in their car or living in their cars. I've seen people at work doing their classes, and so I see them, or at home, if they are, how clean the home is, or do I need to send home health for a safety evaluation? I can see that from the videos and things. It's definitely more eye-opening as to what your patients are actually going through.
So what were almost the aha things, the aha moments that you'd like to tell somebody about?
The amount of documentation that is required for meeting the medical board's guidelines and things like that is quite a lot, and it's almost impossible to meet all of those things and actually do all of those things without a system like OPOS. I find that either you'll just say that you did it, but you never really did those things, because there's just not enough time to look at all of the different surveys, all of the different, the cures reports, drug screens, all of that information is a lot of information to look at. And so to meet all of those requirements on each individual patient would take you a half hour. You wouldn't be able to see the same number of patients doing that all on your own.
What's the one thing about OPOS that really exceeded your expectations?
I think doing the shared medical appointments, because that allows you to see almost a full day's or over a full day's worth of patients in about a half a day. And it gave me time to be at home with my family or add time in the office for procedures. And so that, I think, was a nice blessing. And the fact that I was able to not have a PA in the office, and it allowed me to keep my PAs in the hospital, it actually made me manage my time a lot more efficiently. OPOS has been a very beneficial change. When I first got the postcard in the mail, or whatever leaflet I got, I was like, what is this? This sounds interesting. How would this work? It has definitely exceeded my expectations as to the benefits from a just compliance issue as well as the efficiency, but also there is a financial benefit for both of us.